Good afternoon, and thank you again for joining us for today's briefing. I want to start, as I always do, by updating you on some of the key statistics in relation to COVID-19 in Scotland. As at 9 o'clock this morning, there have been 12,097 positive cases confirmed, an increase of 170 from yesterday. A total of 1,666 patients are in hospital with COVID-19, and that is a decrease of 8 from yesterday. And a total of 99 people last night were in intensive care with confirmed or suspected COVID-19, a decrease of 9 since the numbers reported yesterday. It is worth noting that this is the first time that number has been below 100 since the 29th of March. That is obviously very encouraging news. It does show that the restrictions are working, but it also underlines the reasons why we need to stick to them. So I want to thank all of you for the sacrifices you have made, and I know will continue to make. I know it is not easy, but I hope you are beginning to see, as we do, that those sacrifices are beginning to show results. And of course, I want to thank everyone working in our intensive care units. Your efforts are having a hugely positive impact. I can also confirm today that since the 5th of March, a total of 2,765 patients who had tested positive for the virus have been able to leave hospital. I wish all of them well. However, I also have to report that in the last 24 hours, 12 deaths have been registered of patients who have been confirmed through a test as having COVID-19. That takes the total number of deaths in Scotland under that measurement to 1,571. As I've said previously at these Sunday briefings, these figures should be treated with some caution. Although deaths can be registered at weekends, registration numbers are usually relatively low, and that should be taken into account when looking at today's figures. But as always, I am aware that these are not just numbers. Each one was a person whose death is a source of grief to many. Each one is a life lost. So I want to send my deepest condolences to everyone who has lost a loved one to this virus. As Health Secretary, I also want to thank, as I do every day, all those working in our health and care sector. I've already mentioned ICU workers, but our thanks is due to all staff, the doctors and nurses, the paramedics, care home staff, porters, cooks, healthcare assistants, cleaners, and many, many more. Your efforts are essential to the health of our country, and all of us owe you a huge debt of gratitude. I want to update you today on two areas. The first is mental health, and I'm pleased to be joined by Dr. John Mitchell, who is a consultant psychiatrist and our interim principal medical officer. And as you'll see, I'm also joined by Professor Jason Leitch, our national clinical director. The Scottish Government is already taking significant action to support people's mental health during this period. Today, I'm announcing a further package of support to address the challenges faced by specific groups. There are some aspects of this crisis, the changes to routine and general anxiety, which are tough for all of us. But we know that they are especially tough for autistic people, their parents and carers. So we are providing an additional £200,000 for Scottish Autism and the National Autistic Society. This funding will allow the National Autistic Society to turn many of its face-to-face services, for example, the social groups it runs, into online services. This will help parents and carers and autistic people to keep in touch so that those facing similar challenges can support each other, even if they cannot meet each other. They can be together, even when physically apart. And the funding for Scottish Autism is for the Autism Helpline. I'm going to read the helpline number out in a few moments for anyone who wants to make a note of it. The helpline is already a trusted source of advice and support for the people who need it, Our funding will increase its capacity to help people at a time when there is a high demand for its services. The helpline is available 7 days a week from 8 a.m. to 8 p.m. and the number is 01259 222 0222. That's 01259 222 0222. Our support will help organisations that provide help to those who need it most, and it will ensure that additional support is available during an especially trying time for autistic people, their parents and carers. We also want to enhance the help available to young people. We know that for many children and young people, this is a very unsettling time. It's tough not being at school, not being able to see your friends, and spending so much time at home. So I want you to know that it's okay not to be okay. Last month, we launched a new digital resource which helps children and young people learn about the healthy use of screens and social media. The resource, called Mind Your Time, was developed by the Scottish Youth Parliament and the Children's Parliament, and in the first 10 days since its launch, it has had almost 13,000 views. We're now going to do a bit more. We're providing $105,000 to the organisation Young Scot. That money will be used to develop a range of new digital content on mental well-being. The new content will be hosted on Young Scot's own digital platform, as well as on social media channels like TikTok, Snapchat and YouTube. And it will help to ensure that if young people need information or support, they know exactly where to get it. I'm also announcing today additional support for families. We know that during this period, many people will feel their closest relationships under particular strain. That may be because you're spending more time with your partners, your children, your immediate family, or because you're seeing less of other family members during lockdown. So we're providing £700,000 to The Spark, an organisation which specialises in relationship counselling. The money will be used to expand The Spark's relationship helpline service. And again, I'll read that number out in a moment. The helpline provides help to anyone experiencing relationship issues, and it can also refer people on for more in-depth counselling if that is required. The number for the relationship hotline is 0808 802 2088. That's 0808 802 2088. It's a free service and will now be operational Monday to Thursday between 9 a.m. and 9 p.m. and on Fridays from 9 a.m. to 4 p.m. The most important message I want to get across today is simply this: help is there if you need it. The NHS Inform website can help you to find the services that are best for you, and the website clearyourhead.scot has advice and tips on how to maintain your mental well-being. So please reach out. Help is there for you. The second issue I want to cover is our support for people with drug and alcohol issues. We've already announced a number of measures to ensure that treatment and support services are not disrupted during this crisis. As part of that, we have increased the availability of naloxone, a medication which reverses opiate overdose. Under existing UK legislation, supplies of naloxone can only be held by non-drug treatment services for use in an emergency, but not for onward distribution. In the current crisis, that can present an obstacle to people receiving the treatment that they need. So that's why today the Lord Advocate has confirmed that for the duration of this crisis, it would not be in the public interest to prosecute any individual working for a service registered with the Scottish Government who supplies naloxone in an emergency to save a life. I hope that statement provides confidence and certainty to relevant professionals as they carry out their important work. And I hope it will further ensure that people can get the treatment they need when they need it. I'm also announcing today new support for people who are in prison or about to leave prison. We're providing £150,000 to enhance residential rehabilitation services. It will increase the number of residential places available for people leaving prison. And we're making up to £1.9 million available to support people in prison who need opiate substitution therapy, or OST as it is known. That is currently around a quarter of Scotland's prison population. The funding will make a new treatment called Buvidal available to people in prison. Unlike other substitutes, Buvidal is administered as a 7 or a 28-day injectable dose rather than daily. This change will help to relieve pressure on our prison service. It will ensure continuity of treatment for people in prison, and it is a further way in which we are trying to provide the right support during this pandemic to those who need it. I want to close today by reiterating the public health guidelines. You should stay at home except for essential purposes such as buying food or medicine and exercising. If you do leave home, please do not mix with people from other households and stay more than 2 metres away from other people. If you have symptoms of COVID-19, you and your household should isolate yourselves completely, and everybody should continue to wash their hands regularly and thoroughly. I know these restrictions get only more difficult with time, but I want to emphasise that the sacrifices you're making are making a difference. We're not through this yet, but we're seeing hopeful signs. And it's vital that we stick with it and build on the work that your sacrifices have allowed us to secure. By doing that, together, we slow the spread of this virus, we protect our NHS, and we save lives. So I want to thank you again, and I always will, for playing your part in all of this. Now, let me turn to John for a few words.
Thank you, Cabinet Secretary. Despite the challenges we're all facing, there's rising kindness and compassion in Scotland. Every one of you, by sticking to the guidelines, shows your commitment every day. But this is tough. Some people will find it much harder than others, and that might be because you're worried about your own health and well-being, worried for people you care about, or worried about your future. Scottish Government's Clear Your Head campaign, the message is simple. There are things we can do to try and stop everything getting on top of us, and help is there if we need it. Please take the time to look at the website, clearyourhead.scot. Today, I want to focus particularly on the mental health of children, young people and their families. Young people have told us that they're concerned about several things just now, including exams and coursework, the impact of COVID-19 on their future, but also their mental health and well-being. During these strange times, it's understandable. To any children and young people watching, that means it's okay to feel worried or anxious. It's okay to feel fed up being stuck inside and not meeting friends. There are also knock-on effects on families and relationships. Spending a lot of time together in isolation, parents working more from home or unable to work at all, and juggling childcare. And no matter how much we love those closest to us, this can take a toll on our mental health and well-being. So the announcements that the Cabinet Secretary has made today are all really important. We want to ensure we have the right help in place for children, young people and their families. And this includes providing support for anyone who might be having difficulty with a relationship. It includes support for autistic people, as the Cabinet Secretary has mentioned. We know that autistic people can be particularly affected by the current restrictions, and that's why the First Minister has recorded a special message for them today. We're also listening to children and young people about how they feel. We know that mental health really matters to them. They're passionate about it. So it's great that young Scots are developing information and resources for their website. Young people will be directly involved in creating this additional content. We want that Young Scot website to be the go-to source of advice and support for young people's mental health. And because young people use digital technology in really clever ways, we've published new guidance on healthy social media use and screen time. Social media can be a great force for good, especially right now. The Mind Your Time resource has tips for how to use social media in a positive way. It can be a big part of the little things we do to make ourselves feel better. Before COVID-19 changed everything, the Scottish Government had listened to a youth commission on mental health services and set up a task force to improve mental health in children and young people. We know that more young people were coming forward for help with their mental health. However, we also know that too many young people were waiting too long for help. And we were working hard to improve things. We wanted to employ more specialists to help more people and provide better support in school and in the community. We wanted to reshape the mental health system for Scotland's young people, and we still want that. And although COVID has changed the way that support is delivered, the vital work continues. The NHS is there if you need it. Specialist child and adolescent mental health services remain open and are there to help. The same is true for services for parents who might be struggling with their own mental health. But remember, other sources of help are out there too. Online material, telephone supports, the Clear Your Head website brings all of this together. NHS Inform Young Scot are fantastic sources of information, advice and help, but if you feel overwhelmed and need help quickly, Childline and NHS 24 are there for you. So to children and young people watching, keep in touch with your friends, ask them how they're doing, and listen to them if they're having a hard time. Tell them about how you're feeling too, and let them know that help is out there. Send them a link to Clear Your Head. None of us need to feel down or worried or anxious on our own. Thank you.
Thanks very much, John. And now I turn to Jason.
Thank you, Cabinet Secretary and John. And just to build on the information for autistic people, Scottish Autism is going to run a question and answer session online this week, and I will be taking part in that. It will be at 7 o'clock on Thursday evening, and they're taking questions up until tomorrow evening. So if you want to take part in that, please look at their website. The other thing I want to do briefly is discuss the guidance that remains in place. It can get a little confusing, so let me try and be as clear as I possibly can. There are 4 groups presently in Scotland. There is the group that is isolating. Those people have symptoms, so if you have symptoms of a cough or a fever, you should be staying home for 7 days. If you are in a household with somebody with symptoms, you should stay home for 14 days. If your symptoms worsen, you should phone 111 and they will direct you to the appropriate healthcare. So group number 1, isolating. Group number 2 is shielding. Shielding is the highest risk group. It is unusual to get a letter. It's about 170,000 people with diseases and conditions that cause them to be at really high risk from this horrid disease. Those people who are shielding have had letters. We do sometimes add people to that list, either in groups or from their general practitioner or their care teams. Those people are being asked to shield from the 26th of March for 12 weeks, whenever they got the letter. And I say again, we do not do shielding lightly. We don't want to do it, but it is essential for these people to protect them. If you're worried that you think you should be in one of those groups, then please contact your general practitioner or your care team. And the support available to you is in the letter. Group number 2 is those at increased risk. That's about 1.6 million people in Scotland and includes those over 70, those who get the flu injection for health reasons, and pregnant women. For this group, you can leave the house for essential reasons, but we would ask you to be very, very cautious when you do so. It would be safer if somebody else could do your shopping, collect your prescriptions, for example. We recognise that some of you in this group may need extra support. And if you can't get that support from friends, families or neighbours, there is a hotline for you to call that will put you in touch with your local authority and they will endeavour to get you the support you need. That number is 0800 111 4000. They are open daytime in working days. So those 3 groups, the isolating, the shielding, the increased risk, and finally, everybody else. The instructions for everybody else are well known, and you heard the Cabinet Secretary repeat them again today. Stay at home, leave home only for the 4 essential reasons of exercise, essential shopping, helping others, or essential work. And if you do go out, please try and physically distance as much as you possibly can. There is hope, but the gains are fragile, very fragile. And that's why these groups exist, to save lives and to protect us. Thank you very much. Cabinet Secretary.
Thank you, Jason. I'm conscious that we have given out a number of helpline numbers today. So just to assure you, if you didn't get the opportunity to grab a pen and something to write them down on, we will be putting those up on the government website, and they will be in the NHS Inform website too. Let me turn now to our journalists who've joined us, and the first is David Cowan from the BBC. David.
Thanks, Cabinet Secretary. It's been announced today that a paramedic has died from COVID-19 in Scotland. In March, it was reported that you had apologised to ambulance staff, said you were sorry if they felt their concerns about PPE hadn't been heard, and you were taking steps to deal with the issue. That was 6 weeks ago. And the unions are saying there's been a big improvement by then. How confident are you today that the front line of the front line is getting the best protection that's available? And can I ask as well, the Sunday Telegraph is reporting that primary schools could reopen as soon as the 1st of June, presumably down south. Could that happen here?
So thanks very much, David. The first thing I have to say is genuinely and sincerely to offer my condolences to the family of that healthcare worker who has died. In terms of your question about PPE to the front line, as you know, you've heard me say this many times at briefings, that we continue to ensure that we have the orders coming in. We check with those suppliers daily to make sure that they're going to meet the delivery times, that the orders that we have coming in meets the modelling that we've done on the demand, and that when the orders come in, that they're going to come in at the level that we have ordered, the volume is there, as well as chasing additional suppliers to add to the network. And of course, we put in direct distribution routes for some weeks now to ensure that we could distribute PPE direct to our health boards, but also to the ambulance service itself, as well as to social care and to primary care, including pharmacies. All of that is looked at by me every single day to ensure that the volume is there and we're maintaining that pace and that iterative, very focused work. I discuss with the BMA and the RCN at least once a week, and with Scottish Care. One of the issues that we always touch on is PPE and whether there are issues being raised. But in addition, my senior officials have what they call a leadership call at least twice a week, which involves all the unions operating across our health and care sector. And that is where specific issues, I joined the call not too long ago, and very specific issues were raised by unison with me about, not about the availability of PPE, but about the quality of a particular group of items, which I think we've covered in a previous briefing. So I am as confident as I can be, and my caveat around that is that I don't think throughout this crisis that I will be able to say honestly, I am absolutely confident that all items of PPE are reaching absolutely every single person that needs them, of the quality and the type that they need. And that's because there is a global demand on PPE, and the confidence I can give you, the assurance I can give you is twofold. One, that we have a major operation engaged now for a number of weeks on the supply and the delivery of PPE, and that is looked at daily by me, but more than once a day by those who are running that operation. And secondly, that we have routes by which people can raise concerns and issues, and that when they do, we act on them straight away. The second question you asked is about the opening of schools, be it primary or secondary. I think the First Minister has been clear, very clear consistently, but also very clear this morning when she said that we will decide as a Scottish Government when it is right for our schools to open in any phased or other way. We are, as you know, working our way through all the options and with the clinical and scientific advice to understand where we have got to now with that R number, that reproduction number for the virus, but also and that's why we are saying right now there are encouraging signs, but the progress is fragile, where we think we need to keep going in order to do that, and what any easement of the current restrictions is likely to do to that R number. And our next stage in what we have begun, which is that open conversation, we began it with our framework for decision-making document. We will say more about that in the early part of the coming week. And then as we move through towards the 7th of May, the next review date, we will be saying more about what we think is the right thing to do for Scotland. We will, as always, look for consensus across the 4 nations of the UK about what we're doing, but we will take the decisions that the evidence tells us are the right decisions for the people of Scotland. Thanks very much. It's Ross Govins next from STV.
Thanks, Cabinet Secretary. If up to a half of care homes in Scotland have or have had cases of COVID-19, when can we expect to see a peak of cases in care homes and get that R number falling?
So, as you know, the focus of our work on care homes is one that I take very seriously. Right at the moment, we have 40% of care homes with an active COVID case, one case or more than one case. And we have introduced a range of measures starting on the 13th of March with that very clear clinical guidance which should have ended communal activities and ensured that visiting was stopped. We have put in a number of measures since then in terms of testing, the most recent being the testing of all residents in a care home and staff in a care home with an active case, and that has now begun, as well as looking at where there might be links between care homes that are owned by one particular private provider, any particular private provider. And more importantly, or as importantly, wrapping around our care homes, in addition to the links that they will have with their local GP practices, the full support of the wider primary care team, and including NHS staff, where that is what is needed to increase the resilience of care home staffing, all led by our Directors of Public Health. So we are continuing to do everything we can in consultation with Scottish Care, of course, and others, to ensure that we are providing the data that is needed to help us increasingly understand what is happening in our care homes, but also, most importantly, the clinical support to ensure that proper infection prevention measures and control are being undertaken in those care homes. Staff have the PPE and the support they need. You know, we put in place particular measures for private and public providers of care homes to ensure that that was the case. And we look at it every single day to see if there is more that can be done. We can't yet say where we are on the case numbers. We need to see the data come through a little bit more before we could answer your question as to whether we think we have, at that point, begun to control the number of cases in our care homes. But that is absolutely our number one priority in all the work we're doing there. Next is Katie Spencer from Sky. Katie, are you there?
Hello, can you hear me?
I can, thank you.
Hello. I think there's some confusion today really about what the situation is for over 70s. Do you understand the frustration when on a lot of government material, government websites, they're listed as clinically vulnerable? And I think many feel like they've been told that they had to isolate and shield themselves for 12 weeks. And many would feel like perhaps the advice has been a bit misleading. Are you saying now that healthy over 70s can actually go out and do their shopping? Secondly, as well, the First Minister has said she would be willing to ease lockdown restrictions differently from the rest of the UK. Might Scotland be considering a different approach? Could that involve perhaps different age groups being allowed out at different times of day?
Okay, let me deal with both of those questions, and I'm going to ask Jason to particularly deal with the point about those who are over 70. And remember, that group too also includes people who we would broadly describe as people who currently are eligible for the annual flu jab. The guidance that Jason has outlined today is no different from the guidance that we've outlined here from the very beginning. I think we've been consistent and clear, but Jason, you might want to say a bit more about that.
Well, only that I understand the challenge of setting an age limit. And we haven't done that lightly, because there are a lot of 70-year-olds who are fit and well and fully engaged in society, many of them still working, in fact. The challenge here is this disease, irrespective of pre-existing conditions, affects over 70s harder. In fact, it affects each age group harder. There is a curve. So you have to choose an age at which you're going to say that group is an increased risk. And that has been, around the world, around 70. That doesn't mean that group has to shield. Remember, shielding 170,000 people, very specific diseases with individual letters. But that group of over 70s, like my parents, some with pre-existing conditions, some without, have to be careful. They can leave the house. My own parents are leaving for exercise every day, but it would be safer if they got somebody else to do the shopping if they're able to do that. If not, of course, they can do essential shopping if they have to. So that group we're looking after because they are more at risk when the disease hits them, I'm afraid. And as soon as we can change that, we will change it.
And I want to just repeat that in that group of people for whom, if they contract this virus, the risk to them is more serious than others, with the exception of the shielding group. That group that is those over 70 also includes people who are eligible for the annual flu jab, and many of them will be under 70, but they have particular conditions, could be asthma, could be other conditions that make them eligible for the flu jab. So this is about trying to ensure that people have maximum information and our best clinical advice and guidance about what it is that we believe they need to do in order to protect themselves from the very serious impact that this virus could have should they contract it. Your second point was about whether or not in Scotland we would ease any of the restrictions differently. I think we have been clear all along that where we can reach a consensus of view across the four nations, then that is what we would want to do for the simplicity of message apart from anything else. But our responsibility, my responsibility as the Health Secretary, the First Minister's responsibility as the First Minister of Scotland, is to take what we consider to be the right decisions for the people of Scotland. And we will continue to do that. And we will later on this week, as I've said already, set out the next steps in our current consideration about what might the options be, how might we take those forward. But those options that we think at this point we should sensibly be very honest and clear with people are not likely to be lifted on the 7th of May. All of that will be set out in the early days of the coming week in our attempt to continue that open and transparent conversation with the people of Scotland, where we set out very clearly the decisions we're making, but also the rationale for those decisions. Next, we have Anita Stratton from Global.
Hi there. Thank you. Can you hear me okay?
I can, Anita, yep.
The National Clinical Director, Jason Leitch, has moved to clarify the guidelines today for people shielding, with letters being sent out 5 weeks after lockdown started. It can be confusing. The letter we saw was dated the 30th of April with the advice to stay home for 12 weeks from today. We know the advice is to actually stay at home from March the 26th. Plus, the signatory on that letter is still Catherine Calderwood as Chief Medical Officer, given it's a month after she stepped down. Will you be updating the format to clarify The advice is to shield from the 26th of March and updating the signatory. And who, in your mind, should that signatory be?
So thanks very much. It is an important question. It's partly why Jason made those opening comments that he did make. I'm going to ask him to say a little bit more about that in a minute. As you'll know, when we talked about the shielding group in the first place, we did say that individuals might be added to it based on the clinical judgment of their GP or their clinical team if they had a consultant-led team. And that is partly what we are seeing happening now, with individuals being added to that list and receiving that letter. But I completely accept that the way the letter is currently framed can be confusing for folks. And I'll let Jason describe or explain to you how we're going about sorting that out.
So we're going to do two things. You're absolutely correct that that letter is a little confusing, and that's why I said what I said today. It is 12 weeks from when we started the shielding process for whoever is now shielding. Let me be very clear, we don't take shielding lightly. It is really, really tough. Tough if you're 30 or tough if you're 74. It's really difficult to shield because it's very rigorous staying at home and even on occasion having to self-isolate from your own family to protect yourself. So everybody who is shielding should shield from 12 weeks from the 26th of March, and we will be in touch with those individuals again as we approach that, so we say what the evidence says about what should come next. And Gregor Smith, the interim Chief Medical Officer, will be signing those letters from now on.
I don't know, John, if you want to say a little bit about the mental health and well-being support that is available for people whom we are asking and have been isolating for that length of time. That's tough for them.
Yes, it is. And Age Scotland have been working very hard on thinking about how can we provide support for older people who are perhaps less used to or less willing to use digital technology in the way that young people do. The local authorities, I think, have given out phone numbers so that individual support can be provided at a local level. And I think we are very impressed and grateful for all of the communities that have emerged of people helping each other and supporting each other, whether that is digitally or through the telephone.
Thanks very much. Tom Magner now from Carers World Radio.
Thank you very much indeed, Cabinet Secretary. Can I press you on this point about age? Because it's an issue which angers a lot of our viewers, and there's indeed a lot of frustration. And really it's coming down to this. Does it not, it feels to me and to our audience that it's easier to think with the blunt instrument of age rather than perhaps a fairer method of looking at activity and case-by-case specific health risk as a way of easing out of lockdown and an exit strategy?
So there's a slightly different question there that you're asking me, I think, Tom, and that is about how we consider age, if you like, and particular groups of people as we think through what measures we may be able to ease in terms of easing the current lockdown restrictions and in what way. And I think that is a really important question to be asking, not only to consider the particular steps that we might think are sensible to take and at what point, bearing in mind that the overall objective remains to control the spread of the virus, because by doing that we save lives. And that has to be the most important thing that any government anywhere in the world is focused on. But your point is an important one. I don't know, Jason, if you want to say a little bit more. We can't give you, at this point, a definitive answer to that, but I can assure you that we are conscious of it. And whatever decisions we do take as we go through this period, for some time to come, we will be as open and transparent as we can be about the rationale that we have taken to reach that decision and the evidence that we have used and the clinical advice that we've received to help us make those judgments. At the end of the day, the judgments are for governments to make. But I don't know, Jason, if you want to say a bit more about how that might be done in terms of health as opposed to only age.
On the way into this, Tom, we've only had 4 months of the virus. The mortality numbers around the world show us that even without pre-existing conditions, the over 70s are at too high a risk for us not to put them in that category. I understand I have family members who are equally irritated, as your listeners clearly are, and we don't put them in that category lightly. We're not saying they have to stay at home. We're saying they have to be very, very careful if they leave home. That's true of the whole population, remember? But we're saying this group in particular, if they get the virus, even if they have no COPD, have no diabetes, if they're not obese, they are still suffering more than the under 70s. And that's a really hard message to give to a half marathon runner who happens to be 71. I completely understand that. But at a population level, we have to make choices in order to get that messaging out to the whole population. I think your second point is also a good one, as the Cabinet Secretary has said. As we come out of this, there may be more opportunity to make more nuanced changes according to disease, age, area, whatever that might be, but we are not in a position to do that yet.
Thanks very much. Tom Eden now from PA.
Thank you, Cabinet Secretary. Good afternoon. I just wanted to first off start with a bit of clarity around your the Lord Advocate's update on naloxone. In your statement earlier, you said no one working for a service registered with the government will be prosecuted if someone supplies in an emergency to save a life. I was just wondering what that means in terms of distribution of it and supply for other public services. And then what has this been inspired by? Have you seen a spike in drug deaths during the lockdown?
So what it does mean, thanks very much for that, Tom, what it does mean is, of course, this naloxone drug is a very important drug, and its use is to reverse an opiate overdose. So in the circumstances where you're using it, that is an emergency because you're trying very hard to save someone's life that would otherwise potentially be lost. The particular advice that we've now helpfully received from the Lord Advocate allows other services that are registered with the Scottish Government to hold that drug so that if they need to use it, they can use it. And that means that we are widening the possibility of that drug being used to save lives. And the reason that we're doing it is a precautionary measure primarily to ensure that in this current difficult position that people find themselves in, we've talked about the difficulty of the current restrictions. We've spent a lot of time today talking about the mental health and well-being impact of that. We know that many services have had to move online, and that can make it difficult for people who are dealing with addiction issues, be it drug or be it alcohol, that in those circumstances that their mental health may decline and they may then be vulnerable to an overdose of opiates. And that is why we are making this particular move now that we have the Lord Advocate's guidance on that. Andy Phillip from the Daily Record.
Hello.
Hi, Andy. Hi.
Hi. Just ask you, there's some calls to get construction sites back open, but one union telling me today that the timing is wrong. Workers are nowhere near ready for business as usual. Their concerns being about the ability to carry on with social distancing and with personal safety. So I'm just wondering if you can tell me what work is being done with unions or construction firms in Scotland to ensure those protective measures and safeguards are in place, and when construction might well be phased back in Scotland.
So the first thing I have to say is that no decisions have been taken yet. Let me repeat what I've said already about how we will set out in the early part of this week the next steps in our consideration about whether we can ease any of the current lockdown measures, and if possible, what might they be, and when might that be the case, and the work that we will take forward throughout the rest of this month. The second thing I think that's important to say is that my colleague Fiona Hislop, Cabinet Secretary for the Economy and Fair Work, is in regular contact with all the unions and with the STUC, and these kind of considerations form an important part of those discussions. And I understand well the anxieties that many workers face when they see headlines that say their particular industry or their place of work might open anytime soon. I need to say very clearly, those decisions have not been taken. Our first priority remains to control the spread of the virus, because that way we save lives. We don't want to continue in lockdown any longer, for a minute longer than we need to, but we need to balance carefully how we can continue to suppress the virus and save lives whilst we look to see whether there are any indications of normality that we can begin to reintroduce. And the final point I'd make, I'm sure many people will have seen today the recent opinion poll, which indicated that the population of Scotland remains very supportive of the current measures and want to know that any easement of those have been very carefully thought through. That will, and includes mitigation and other support. And we've said from the outset that social distancing, physical distancing, will be with us for some time to come. So all of that needs to be applied in our thinking and our rationale, and we will make some of that clearer in the coming week. Christine Lavelle from The Sun.
Hi, Ms Freeman. Donald McCaskill from Scottish Care has said today that he expects the number of deaths in care homes to keep rising over the next 2 weeks. The implications of that one are obviously horrifying. If weekly deaths peak next week at just above the most recent 7-day toll of 338 and then fall at a similar rate at the increase we've seen so far, that would mean around 2,500 deaths in care homes over the course of this outbreak. Is that what you fear? And is there anything we can do to stop it?
So my approach here on this is that any death is one death too many. And I don't have a number that I would find ideal in any respect, whether that is in care homes, people at home, or people in our hospitals. And I think that is the approach of our entire health service and everyone working in our social care sector, whether they're delivering care at home or whether they're working in care homes. So that has to be what drives us forward. And that is why we have taken all those steps, starting from the 13th of March, with that absolute clear guidance about what needed to happen in care homes, the steps we've taken on PPE to ensure that we can top up those private providers' own supplies and give them emergency supplies if that is needed, direct delivery of PPE to care homes and a very clear route for them to ask for and order additional supplies and to receive that. The move of the directors of public health to give them that authority and focus to ensure that everything that is can possibly be done to provide primary care and clinical support to care homes is now being done. Our GP practices have always had strong relationships with care homes. This was simply about enhancing that, and all the additional measures that we've already taken on testing and announced further on Friday, those additional measures. All of that is focused on controlling the spread of the virus in care homes and making sure that we do everything we can to reduce the number of deaths. And that will continue to be my focus and the focus of all of those people I've mentioned for the weeks to come. Andrew Learmouth from The National.
Thanks very much, Cabinet Secretary. Following on from your naloxone announcement, can you say if the Lord Advocate is minded to look again at calls for a drug consumption room? Can we expect him to grant immunity to health workers to allow safe consumption rooms? And following on from Tom's question, from Tom Eaton's question, are you able to say, how many suspected drug-related deaths there have been since the coronavirus outbreak?
So on the first question that you've asked, I don't think we should jump from one thing to another, although I understand the temptation to do that. The Lord Advocate will reach his view on safe consumption rooms in the fullness of time, and as soon as we are able to do more on that, then we will, of course, advise everyone. On the numbers of drug-related deaths, those statistics will be published in their normal time. We are, of course, interested about what we've described before as the other health harms of the necessary work that has been undertaken to address the crisis of the pandemic. Some of those health harms from these platforms before colleagues have talked about our continuous message that the NHS is open and there for you is an indication of how seriously we take that. But on the question of drug deaths in particular, those statistics will be published in the normal time, and we will be continuing to look further at what those might be telling us. Next is Scott McNabb from the Scotsman.
Yeah, Cabinet Secretary, Linda Ball, the public health expert today, suggested we need quicker, more urgent action to pour resources into the teams which will be required for the test, trace and isolate approach, which will follow lockdown, both clinical and non-clinical staff. I'm wondering if you can update us on where we are with that in Scotland. And also, Grant Shapps has been talking about trialling the NHS X app on the Isle of Wight, which will be part of that approach. Can you tell us where we are with that in Scotland? Would that be the mobile app tracing technology that we would use up here, or will we have a separate sort of app?
Thanks very much, Scott. So the whole approach on test, trace and isolate is, as we've said before, a critical component as we come out of the current restrictions. At whatever time we might do that, in whatever way and phased way we might do it, test, trace and isolate will be a critical component. And I think it was towards the end of last week that the First Minister said that in this coming week we will publish our overall strategy, the work that we've got underway, well underway now, to increase capacity, not only in terms of testing. You'll know that we more than met our target of 3,500 tests last week, but have gone further and will be at 8,000 NHS tests by the middle of May. But we need to increase that capacity even further in order, even with the work from the Lighthouse Lab in Glasgow, to increase that even further to meet what we anticipate to be the demand. We've not finalised that work yet, but it will be published. But it's not just about lab capacity, it is also about the capacity of tracing, contact tracing, and then the very difficult issue that is part of that, which is asking people to isolate. Now, all of that will be published in the early part of the coming week about the strategy that we are adopting, the tools that we will use, both human and digital, and the steps that we will take, including the work underway to get us to where we need to be in terms of that overall approach. In terms of the UK NHS X app, which is the proximity app, we are still working with colleagues in Public Health England and Digital England to understand some of the technical issues around that, to ensure that if it is possible, then it feeds into our strategy too, and the two are compatible with each other. We've not yet finalised that yet, but as soon as we do, we will make sure that people know whether that particular additional digital tool is one that we can make use of here in Scotland. Next is Rachel Watson from the Daily Mail.
Hi, Health Secretary. I just wanted to pick up on a point about care homes again. The Chief Nursing Officer was on television this morning, and she said that residents going into care homes, so whether that was from hospital or from the community, wouldn't necessarily have their coronavirus test results back before they went into care homes. I just want to check, does that not make testing them effectively pointless because they are in the care home and could have the virus already?
No, it doesn't make it pointless, because remember that what we have said from the outset is that new admissions to care homes should be isolated for 14 days. So someone going into a care home, unless they are going in with a test that clearly tells them, even if they are going in with a test that clearly tells them they're negative, they will continue to be tested with their consent along with other residents now. But if they are going into a care home and the test result is not yet through, they should be isolating for 14 days. That's entirely consistent with what Jason said at the outset. So it doesn't make it pointless at all. As soon as the test result comes back, it wouldn't take 14 days for it to come back. As soon as it comes back, if it says the person is negative, then they would be in that care home like other residents would be, not isolated necessarily, but certainly in their own room, because that is what the guidance on the 13th of March very clearly said. No communal socialising, no communal dining. So that's been in place now for well over a month. But in terms of testing new admissions to care homes where they are not being discharged from hospital for COVID, where they would be giving 2 negative tests before their discharge, in other cases, they will be isolating for 14 days or until the test results comes back. If it is negative, then they are in the same regime, if you like, as other residents in that care home. Next, we have David Ball from the Herald.
Thank you very much, Cabinet Secretary. This morning, the UK Chief Statistician Ian Diamond warned of a surge in indirect deaths in the next few years, with cancer screenings currently being delayed. Are these screenings going to be restarted soon, given the hospital admissions have stabilised? And also, are you still concerned that there's no checks at airports for visitors coming in from abroad?
Thanks very much. I'm going to ask Jason to say a little bit about screening. The one thing I would say is, before we turn to that, is that it is too early to assert that hospital numbers are stabilising. You know, we've said before, I've said it this morning, I'll repeat it, the numbers that we are seeing is encouraging, but we're not yet in a place where we can confidently assert that in terms of the numbers of cases coming through, that we are stabilising that at a low number that the NHS can cope with, much below the capacity that we've introduced to our NHS, but we need to see those numbers coming through for a little while longer before we're in that place. Just before I go to Jason on screening, we are very conscious of the importance of our screening programmes. We've seen the great value from them to individuals as well as to our National Health Service, and pausing them in any respect was a decision that was taken very reluctantly indeed. And so they are part of our overall consideration. But Jason, you might want to say a bit more about screening.
Only to say that all of these judgments, both turning systems off and turning them back on, are risk-based. It's not, unfortunately, like a light switch. You can't just make a really simple judgment. The decision on a risk-based basis was made to postpone some of our screening programmes, not to cancel them. Nobody is missed out. We will catch up with that backlog, and we will catch up as quickly as we can. So if you have had a bowel cancer screening envelope, you should keep it, and you should use it when we tell you that screening programme has been reactivated. And the risk was too great to not do that, because we had to move people around labs, we had to move clinical teams around for COVID. And the Cabinet Secretary is absolutely right. Just looking at raw bed numbers is the wrong metric to think about the National Health Service restarting, because we have to think really deeply about the safety of staff, of patients, particularly of those in those vulnerable groups who we're going to ask to re-enter that National Health Service. So these judgments will be very difficult, and they'll be made when it is safe to do so, including the screening programmes.
Thanks very much. And look, your last question, your other question was about entry at airports or indeed other ports to the UK. As you'll know, I know, David, that power, if you like, is reserved to the UK government. We can't close those ports, but I think we've made our position very clear that given that it looks likely that all the sacrifices that people have made is being successful in suppressing the virus, we think that the UK government should take a very serious look indeed at the potential risk of inward transmission of the virus, and begin to consider very seriously and make decisions very soon around how that particular risk can be managed and managed effectively. We've seen it elsewhere, and it should be something that we are able to do, and we'll continue to raise that with the UK government and press for the right decision to be made there. And lastly, Callum Ross from the Press and Journal.
Hey all. I just wondered if you could update us on the situation with the virus in rural areas at the moment, like those in the Highlands and Islands. The numbers appear to be low relatively, but I think we had the first cases in Skye confirmed last week. I was just wondering if there's a danger that the situation might worsen in these types of places after the peak's been passed in the rest of the country.
It's not, as I understand it, Jason will, I'm sure, correct me if I'm not right here and maybe want to say a bit more about it. But as I understand it, you know, we talk about the R number, the reproduction number, and the estimate is that at the very start of this pandemic, it was over 3 in Scotland. That meant 1 person infected 3 others, and it's now around 1, just under 1. The difficulty in modelling in a country of our size is being able to do that at the level down from country modelling into the granularity that you might get if you looked at individual local authorities, for example. So that is very difficult to do with confidence and produce results that we can be confident about. That said, we are, of course, very conscious of the difference in our country in terms of geography and population spread, communities across the country and so on. And all of those factors will feed into the judgments that we do take about where we deploy resources, how we might move from the current lockdown restrictions to any easement at any point, and how we might do that. And we, as Health Secretary, I am very focused on ensuring that every part of our country, regardless of whether it is a remote or rural community in the north or the south of Scotland or the Central Belt or our islands, that all of them have the resources in terms of staffing and otherwise that they need to do the job that we're asking them to do. And that is, for example, one of the reasons why, having started out with NHS labs only in Glasgow and in Edinburgh, all of our territorial health boards, including our island health boards, now have that capacity achieved in a very short space of time, because we recognise the importance of the speed of testing and the speed of turnaround in results. But I don't know, Jason, if you want to say a bit more about how possible it is to understand what's happening at different levels of our country.
We know that over-interpretation of regional data, particularly when it's small, is a dangerous thing. So we should be very cautious in reading too much into small numbers of cases in small areas. We do know globally that the virus prefers dense populations. The virus spreads more rapidly. That's why physical distancing is the key public health measure, along with hand washing. The borders between our local authorities are, of course, porous, that people can move. So it makes me slightly nervous when we talk about regional differences at that level, and we can't tell you the R number for population X versus population Y at that level. But there are, as the Cabinet Secretary says, on the way out of this, there will be considerations made about all of these different variations that we see across the country.
That's everyone now. That's all our journalists. Before we go, can I just repeat those important public health messages? I truly do understand that this gets harder with every day that passes, but please stay at home, only go out for those essential purposes that we've described. When you do go out, maintain that physical distance of 2 metres. Don't mix households. Don't have your household mix with another household. And please continue to wash your hands thoroughly and properly. I can't thank you enough for everything that you are doing to help all of us address the crisis that is this pandemic. But what you are doing is making a difference. And for every day that you stick with it are the days where we strengthen our capacity to suppress this virus and to save lives. So let me thank you very much for all of that, for joining us again today. I want to thank John and Jason and Anna, our sign language interpreter, and to say that we will be back tomorrow at the usual weekday time of 12:30. Thank you very much. Good afternoon.